Doctor, what is hemophilia?
Hemophilia is an inherited blood disorder that causes bleeding. Normally, when the blood vessel is injured, a clot forms to stop bleeding. In these patients, factor VIII or factor IX, which are important proteins in the blood for making fibrin, are too low. Without proper fibrin, a clot cannot be formed properly. Hemophilia A, which is due to the lack of factor VIII, is much more common than hemophilia B, which is due to the lack of factor IX. Many hemophiliacs lead normal lives. Hemophilia is rather rare, occurring in 1 per 20,000 newborn boys.
Doctor, what causes hemophilia?
Hemophilia is genetically passed to children, usually boys, by their mothers. It's called a sex-linked hereditary disorder. Women usually have no symptoms because they have two X chromosomes, so one can be affected but the other one has normal genes. Men have only one X chromosome, so if that one is affected, hemophilia results.
Doctor, what are the symptoms of hemophilia?
Bleeding and easy bruising are the most common symptoms and can be mild to severe. Some people bleed after a minor injury, others rarely bleed, and sometimes bleeding starts without an injury. Bleeding can occur anywhere, but many bleeds start in a muscle or joint such as the knee and may cause pain or swelling. Bleeding gums and bloody urine are also common. Other symptoms include joint and muscle pain or stiffness and slow wound healing. Hemophilia can cause damage to the joints, causing them to tighten and lose the ability to move.
Doctor, how is hemophilia diagnosed?
Hemophilia is usually diagnosed in childhood, but sometimes people are diagnosed in early adulthood, such as after a tooth is pulled and bleeding can't be stopped. The doctor will take a medical history, do a physical examination, and test blood for levels of factor VIII and factor IX. The doctor will refer you to a hematologist, who is a specialist in treating blood problems.
Doctor, how is hemophilia treated?
Treatment involves replacing blood factors or using medicine. When bleeding starts, treatment must start also, usually as self-infusion of factor VIII. If started at home, infusion can continue at the hospital. Serious bleeding needs hospital treatment. To prevent damage, bleeding into a muscle or joint must be stopped as soon as possible. Surgery is sometimes needed to fix damaged joints or muscles. Special physical therapy exercises may help heal joints. Pain medicine is given. People who suffer trauma should go to the hospital immediately. People who need surgery get factor replacement before and after surgery. Medicine such as desmopressin or aminocaproic acid can be used in mild cases. Contamination of blood factors has caused more than 50% of hemophiliacs to be HIV positive.
Doctor, what are the do's and don'ts in managing hemophilia?
Do tell your doctor if you're going to the dentist or having surgery. Don't use aspirin, ibuprofen, naproxen or other non-steroidal anti-inflammatory drugs. These medications increase the risk of bleeding. For more information log on to www.healthlibrary.com.